Prevention is key. That's what health experts say when it comes to viruses like measles. The Georgia Department of Health says there's already been one case this year, and that's in Atlanta. Fariha Abrar spoke with health experts about symptoms to look out for and how to avoid getting sick.
Dr. Uwa Igbobadia says she had measles when she was about a year old in Nigeria. She says she got it from her mom, who was visiting Igbobadia's sick cousin in the hospital.
And she visited her and she came home, and before she could wash her hands, I ran up to her for my mom to come and hold me. That's what kids do. And before you know it, I started off with having the same type of symptoms.
Today, as a pediatrician in Warner Robins, she's teaching folks about the importance of vaccines and symptoms to look out for.
Runny nose, conjunctivitis or pink eye, swollen lymph nodes, malaise, so feeling unwell, not wanting to eat, not wanting to play or have any activities, what we would say lethargic, red, flat rash around the face, and then spreads down to the body and then the arms and legs.
Nurse Kayla Jones says she's never been exposed.
I got vaccinated at 12 months and at 4 years. And so I've grown up in a community with herd immunity.
We always want to make sure we're preventing the spread, preventing the transmission of measles. There are lots of healthy patients that can get immunized, but then there are some that cannot. And so we're trying to protect everyone, including those that cannot be immunized as well.
Doctors say if you think you or your child has any of those symptoms, do not go to your doctor without calling them ahead of time. In Warner Robins, Fariha Abrar, 13 WMAZ News.
The Department of Health says the measles case in Atlanta is a person who was exposed outside the country. They are tracking down people to make sure they find all people who may be infected.
Meanwhile, COVID-19 and flu cases predictably surging since Christmas. That's according to the state epidemiologist. The doctor reports that COVID cases rose 50% in the first week of January. Hospitalizations were up about 75%. She says cases, however, still remain below pandemic levels. And flu cases in Georgia, well, they have doubled since Christmas. Those cases make up more than 10% of healthcare visits. Hospitalizations increased 50% in the first week of January. They also said most flu cases involve the H1N1 strain, which typically peaks this month.